So as we discussed previously, we all have thousands of changes in our genes. Now, some of them affect our health, but we also have many harmless changes in our genes, and it's just a natural part of the variation between people. So these changes are referred to as variations or variants, and that's what makes our genetic material, our DNA, different from person to person.
Yeah, I remember you talking about genes and DNA before.
Right. And I also mentioned genomic testing. It's a type of tool we use to try and determine the underlying cause of the condition. Sometimes we test several genes, and other times we test all of the genes at once.
Yeah, I've been thinking about that test a lot since you talked about it last time. I do want to go ahead with it. I've got to a stage where I really want an answer.
Yeah, okay, sure. Well, look, I'm happy to organise that for you, but before we do, I want you to understand the different type of results that we can get, just so that you know what to expect. And in particular, the likelihood of you getting a clear answer, since that's what you said you were after.
Isn't that the point of the test, to get me an answer?
Well, we do genetic testing because it can be very useful when there is a clear answer. But other times we get results that don't actually explain your condition. And other times we get complex results that we can't even make sense of.
Right, so what you're really saying is I could have the test and not get an answer?
Unfortunately, yes. But I always tell my patients what chance they have of getting a definite result that can explain their condition. And in your case, we're looking at 50%, and that's 1 in 2.
What, 50%? We might get an answer, 50% I'm none the wiser.
Yeah, well, that's true.
Actually, what's it called again when you find the change and it's the cause of the condition?
That type of change or variant is called a pathogenic variant. Now, it's also called mutation because in genetics we sometimes use different words to describe the same thing. So the thing is, I really do hope we find an answer, because then that would explain why these things have been happening, and it will help us avoid any unnecessary tests. And we can also use that information to better understand what will be happening in the future. But it probably won't affect the way we've been treating you. That won't change.
Right.
And look, the thing with finding a pathogenic variant is that we could use those results to test other family members who may want to know whether they've inherited this condition. Right? But we'll talk about family members in just a little while.
Okay. Yeah.
Okay. So, Peter, the complex results we were talking about before, there's 2 main types. So other than getting an answer or not getting an answer at all, we sometimes get some results where we have a variation and we don't quite know what the change means. I mean, we know it's there, but we don't know if it's harmful or whether it's causing the condition.
But why wouldn't you know?
Because the current testing is very good at actually identifying thousands of detailed changes in our genes, but we're still learning about what that changes actually mean.
So you guys are still learning to understand some of these variants?
Yes. I mean, some of them we know very well because we've run across them many times and we've confirmed that they can cause a genetic condition. Then there's others we haven't really figured out yet. And those ones we refer to as variants of unknown significance, or VUSs. Now with these VUSs, we suspect that they might be involved in causing the genetic condition, but we just don't know with enough certainty to say yes it is or no it's not causing this genetic condition.
Okay, I get that. Sometimes you get a fuzzy answer.
And then the final kind of result we can get is when we get something we weren't expecting. And that's referred to as an incidental finding. Now, when we find these things, we need to tell you about them because it's important for your health, but they normally don't have anything to do with the reason you were having the test in the first place. And they're not directly related to your condition. Yeah. But with all genomic testing, there is a possibility. But with the type of test you're doing, gene panel test, there's only a small chance of there being any incidental findings.
Okay, one less thing to think about, hopefully.
It's a lot of maybes, isn't it? Yeah. But before going ahead with this test, it's important that you know what the different results can be. Do you have any other questions?
No, I think I get it. We might get a definite answer that's the cause of my condition. We could find nothing, or we may get some unclear results or something unexpected.
Perfect summary.
Right. Oh, actually, I do have a question. If we find one of those VUSs where you don't know what it means, what do we do then?
Okay, well, there's some pretty clear guidelines about what to do when we get a VUS result. In some instances, we can do some further testing, and maybe that can clarify it. In other instances, we can review it in the future, and sometimes things come to light there. Look, our understanding and knowledge of variants is getting better all the time. And if you do get a VUS result, then I'll probably get you in and we'll be going over this again. We can get the genetics department having some input into this process. And when people do have these sort of results, there can be feelings of uncertainty. So I want you to know that I'll be here to support you. And that goes for if you decide not to go ahead after all.
Okay, thanks. Thanks for your help now and later.
Now, I do want to speak a bit more about your family. I'd like you to give some thought to the impact of your results on your family members.